Good day. I'm Mayor David Alvey of the Unified Government of Wyandotte County, Kansas City, Kansas. Also today with me is Dr. Alan Greiner, Chief Medical Officer for Wyandotte County. We wanted to offer you an update on the measures that we have taken on the COVID virus, stopping the transmission, and just to give you some update on some other information that we think is important to you. As you know, Governor Kelly issued a stay-at-home order for the entire state of Kansas. And Governor Kelly's stay-at-home order for the state of Kansas supersedes any order by any municipality or by any county. This stay-at-home order is simply meant to stop the spread of the transmission of the coronavirus. We have instituted the 6-foot rule. Please keep 6 feet between yourself and another individual, because that's about how far a sneeze can travel, and that's really how far the virus suspended in air can travel from one person to another. It's extremely important that you maintain that 6-foot rule. We have to continue to flatten the curve. That is, the number of new infections, that rate has got to decline and be relatively flat, because if we don't, we risk overwhelming our healthcare providers. We may run out of hospital beds, we may run out of intensive care unit beds, we may run out of ventilators, as has happened already in New York City. We have to avoid that, and if we can stop the transmission now because we got out in front of it, we're going to be in much better shape just 3, 4, 5 weeks down the road. Health experts say the apex of this may hit our region in late April, early May, and frankly, there's really no way to tell when we're going to hit that high spot of the transmission, so we have to be paying attention every day. The sooner we maintain social distancing, the sooner we follow hygienic procedures, the sooner we follow all the measures that have already been recommended, the sooner we're going to be able to get back to normal. So I urge each one of us, take this seriously. If you do not like the disruption to your life, try to shorten it by stopping the transmission. Already, 30 states impacting about 3/4 of our country are under stay-at-home orders, and those orders, again, will stay in place as long as the risk of transmission is high. So each one of us has a personal responsibility here. We have to have voluntary compliance. Each one of us has to take it seriously. And unfortunately, we are getting reports, and I receive reports myself, that some people are really not paying attention to that 6-foot maintaining social distancing. A lot of people came together, for instance, at Wyandotte County Lake Park in shelters, in large groups. That's dangerous because, in fact, you risk transmission. No person in that group can say for certain that they do not have the virus. They may not have the symptoms. They may not have been around someone they thought had symptoms. But the fact of the matter is 20% of all cases are transmitted by people who are showing no symptoms at all. So the fact that you don't have symptoms, or I don't have symptoms, is no indication that, in fact, I am free of the virus. And that means I could transmit it even if I don't know that I have it. So we are enforcing this order, and there will be folks going to the parks this weekend, law enforcement going to the parks to make sure that we are following the 6-foot order. This is a state order. We're going to enforce it. It has to be done for the public health of our community. And for anyone who may receive a fine, it is a Class C misdemeanor, and that's a $500 fine. Beyond the fine, the most important thing is protect yourself, protect your loved ones. Again, you could be carrying the virus even on your clothing for days and not know it. So please, maintain social distancing, follow the proper hygienic procedures. So as we move forward, I want you to know how we've been going about trying to make the decisions. Each day at the Unified Government, we try to get just a little bit bigger than what's facing us. We try and stay larger than what is confronting us, and we're trying to stay out in front of it. So since this began, we've been convening almost daily meetings of community leaders, anchor institutions. That includes Dr. Mosier from KCK Community College, Monsignor Swetland from Donnelly College. It includes executives from University of Kansas Health System, our Public Health Department, Providence Hospital, the school districts from Wyandotte County, the mayors of Edwardsville and Bonner Springs, our health foundations, mental health providers, social care providers. We're doing this on a daily basis so we can gather information from across the community and come to common decisions, common approaches, and then make sure that information is spread out through those folks to all their organizations. I've also begun meetings with the pastors. We have 400 churches in Wyandotte County. We're trying to bring them together every week to 10 days just to give them an update, to ask for their help, to bring to us their concerns, and we are also doing the same with our business community. All of these efforts are simply a way for us to stay bigger than what is facing us. And frankly, I believe that so far we've been able to do that. But make no mistake, we are just at the beginning of this. We have many more weeks to go before we will even be able to say that we think we are beyond this. Let's take this seriously. Let's try to flatten the curve. Let's stop the transmission so we can get back to normal much sooner. I want to thank the Commission, Unified Government Commission, for their work because they extended the emergency order for our locality, and they just recently expanded the Unified Government Small Business Grant Program. And so that's going to be helpful for our small businesses. We've made some changes there. If you are interested in that, please go to the website, click on the link on small business assistance, and I think you'll find what you need there. If not, just call the office. We'll make sure you get the information you need. So that's just kind of an update from our side. Again, we continue to try and communicate English, Spanish, all languages, community leaders. We're trying to get it out as much media as possible. If you have a question, though, go to the website. We have a lot of information there, practically everything you need. If you have a question, you don't find the answer you need, let us know. We want to put that out there. So having said all that, I want to pass this on now to Dr. Greiner.
Thank you, Mayor Alvey. I just want to give a quick update on the number of cases we currently have. So as of today, March 31st, 2020, we have 78 confirmed cases that are Wyandotte County residents here. We have 4 deaths, and all this is available on our website as well. We're also in close partnership with local healthcare facilities and the hospitals, and we know that 28 total patients are hospitalized at present and have been diagnosed with COVID-19. And we have about 30 additional patients in the county's hospitals that are under investigation for COVID-19 and awaiting their test results. At present, we feel like we have the healthcare capacity to take care of folks, and so if you do have questions, or especially if you have symptoms, check in with your regular healthcare provider. If you don't have a healthcare provider, and if you have symptoms as well, you can also go to our website at wicokck.org and report your symptoms with our online symptom self-reporting tool, and then we'll follow up with you out of the health department, and we have healthcare professionals manning those calls so we can answer your questions and provide more information within 24 hours if you report symptoms that way. The reason it's so important, though, that we do all the things that Mayor Alvey discussed is we really know from other countries and from what's going on the coast in the United States right now that our healthcare system will become overwhelmed if we don't slow the rise in the number of cases that we're seeing. And the measures we need to implement, we really need to implement now. You've heard lots and lots about social distancing and the importance of stay at home. We really need people to stay away from other individuals that they haven't been living with. So that could even be family members. Again, we want people out at the parks, but we want you to stay 6 feet away from folks that you don't live with. So even if it's family members, they could be infected and not know it, and you giving them a hug is potentially putting you and the rest of your family you do live with at risk. So stay your distance from folks during this time when we really got to slow down transmission. We at the health department in Wyandotte County are conducting daily contact tracing activities. So whenever we get a positive case, either a case that's in one of the local hospitals or a case that's at home but has been tested through a local healthcare provider, we call that individual and we try to find out who all they've been in close contact with. So people that they've been within 6 feet of in the days prior to them becoming ill, and we go back 5 days before they developed any symptoms, and then we try to contact all of those individuals. So we're making a lot of phone calls, and we appreciate everything people are doing to try to report their symptoms on our website, because that helps us with that tracing. Just today, we've had a couple of large businesses in the community, as well as a unit that's part of the government itself, that have had positive cases, and we've had to network through those entities to figure out who those positive cases might have been in the same office with, who they might have had lunch with, things like that, so that we can get the word out to all those individuals that they need to quarantine, because people that have had close contact with a positive case do need to quarantine for a 14-day period after that last contact. And we want to answer people's questions as well, so that they can be sure they're protecting their families and protecting others that they might have come into contact with or could potentially come into contact with. So we'll continue that work. We appreciate all the partnership across the community. As Mayor Alvey mentioned, all of the major anchor institutions are involved in calls, and we're trying to really communicate so that we can all work together. I just want to emphasize again, personal hygiene is extremely important. Washing your hands frequently, using hand sanitizer, covering your cough, and making sure that you clean surfaces on a regular basis, especially surfaces that might be contacted by the public or other individuals. For those of you engaged in essential businesses, it's important for you to do those activities to protect yourself. And then remember to social distance. Even if you go to the grocery store, if you're staying at a distance from the people you're around, you're protecting yourself and you're also protecting them. We've all got to work together and contribute to this. I will say that the work we're doing with all our calls and interactions, people are extremely cooperative, and they are taking this seriously. I think we can overcome this and get beyond it much, much more quickly if we continue that. So thank you, Mayor, for having me here today. Again, stay at home if you can, be safe, and be well.
Thank you.